It may not be the first thing that comes to mind when you hear physical therapy, but pelvic floor physical therapy has many benefits that can improve someone's quality of life. Horizon Health's Dr. Hetal Vora joins me in this episode of Being Well to share more on how she guides patients through this treatment.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for another episode of WEIU TV's Being Well. I'm your host, Lacey Spence, and today we are welcoming in another new guest to the show. Today we have got, all the way from Horizon Health in Paris, we've got Dr. Hetal Vora with us today. Welcome to Being Well.
Thank you. It's my pleasure.
Of course. We are so excited to be diving into the topic of pelvic floor physical therapy. But before that, I just love to let our viewers get to know who we're talking with. So do you mind giving us a little background on how you ended up, doing what you're doing or where you're from?
Sure. Hi, everyone. My name is Hetal Vora. I'm a physical therapist. I grew up in India and came to the States in 2009. I have been a physical therapist since 2009. But I ended up doing pelvic health in 2016. I have 2 children, so I know what the work the pelvic floor muscles do, experienced that, so that's what kind of brought me into this field because I personally experienced, and that's what ignited my interest in this field. So I have been treating pelvic health since 2019. And I also did a women's health residency program. It's a year-long residency program. I enrolled in Florida, and I just graduated last year in July.
Well, congrats. That's always great when you further your education and are able to help people even more.
Sure. Thank you.
So diving into our topic today, I think a great place to maybe start is, what is the pelvic floor? Like what muscles or what's it made up of?
Sure. So how do we define floor? It's the bottom of any structure, correct? So pelvic floor, it's bottom of this bony pelvis. So it's basically made up of all the special group of muscles and the ligaments at the bottom of the pelvis that helps to support the internal organs such as the bladder, rectum, and uterus and vagina in female body. It provides some support. So, like during the childbearing age, during pregnancy, that growing uterus, it needs the support. So the bottom portion that functions to provide the support during that age. Also, there are openings within these muscles, openings for the bladder, for the uterus, and the rectum. Those openings pass through this muscular layer. So we can imagine these muscles, they do the sphincteric function. Sphincter means closing the opening and opening the opening as well. Okay. So closing the opening would help to maintain the continence. So there is no leakage of the bladder content, there is no leakage of the bowel content. Also, equally, opening is important, so there is no pain during urination or defecation. So these muscles, they are very important to provide the support and also doing the sphincteric function as well. These muscles also play important role during sexual activities as well. Sometimes the patients, they have pain during intercourse. It's because these muscles are not doing their proper function. That's when the pain can arise. We don't know anybody when we ask them, like, what is your core? So that's, everybody says my core is here. Mm-hmm. But pelvic floor, actually, it's part of your core muscles as well. So these muscles provide important stabilizing function as well.
Mm-hmm.
Yeah.
No, and definitely when you're talking about providing that support during pregnancy, I mean, my gosh, you're growing a human, all the fluid that's, around them,
Yeah.
the tissues protecting them. So definitely very important that we keep all of that in tip-top shape.
Yes, agree.
So when it comes to kind of your purview, what is pelvic floor therapy then?
Sure. So everybody knows physical therapy. So pelvic floor physical therapy, it's just like specialized form of physical therapy, where physical therapists, they receive the specialized training in order to evaluate the pelvic floor structures, meaning looking at the function of the pelvic floor muscles, looking at the nerve functions, ligament functions, and doing the evaluation and provide the treatment based on the assessment of these pelvic floor structures. So pelvic floor physical therapy includes evaluating the pelvic floor structures, mainly the function of the muscles, and then develop the treatment plan accordingly.
And so who might need this? I know we've kind of already hit on, women obviously, but is it just women, just the ladies, or?
It's actually for everybody, like
Okay.
men and women. I understand men, they don't have uterus, but they do have like prostate, pain or urinary incontinence after any kind of prostate surgeries, because men do have a pelvic floor as well. It's just the muscles, but they don't, in men body, they don't support the uterus, but they do support the bladder and the rectum in man body. So it is beneficial if men or women, if they're suffering from any pelvic floor dysfunctions. It is actually also beneficial for children as well. So sometimes the parents are like their children are potty trained, but then they start bedwetting or urinary leakage during daytime. So I think that is the time when parents, they should talk to their provider or child's provider to look into this treatment option. Also, sometimes the children, they experience the constipation issue. Then they should talk to their pediatrician about if the child could benefit from the pelvic floor physical therapy. Now, I want to highlight here, there are various reasons for having constipation. So one type, it's called the dyssynergia defecation, where the muscles are not doing proper coordinated work. That's when the constipation can occur. So in pelvic floor physical therapy, there is a biofeedback treatment available where we can train the muscles what they're supposed to do based on the assessment. So the muscles, we are trying to restore that muscle function, and that's when we can resolve the constipation issue in children.
For folks who maybe aren't familiar with it, biofeedback, what kind of equipment are you using to try and stimulate that muscle?
Sure, it's actually not the stimulation.
Okay.
Stimulation is the electrical stimulation. It's a different than biofeedback. Biofeedback is just the pressurized sensor or the probe that is being put in the vagina or the rectum. So it sends the signal from the muscle, and those signals are being transmitted to the screen that the patients can see in a visual form, or they can be transmitted in auditory form. So let's say the muscles are overly working in the pelvic region. The patient has a pain, and the muscles are in spasm and they're tight. So patient doesn't know how to relax those muscles, and they come up with the pelvic pain. So we put the biofeedback sensor into the area which we are targeting, and the signals are shown on the screen because the signal picks up the tightness from the muscle and shows on the screen as a high tone in the muscle. So then the visual and the auditory feedback is given to the patients, and the instructions are given to the patients and teach them how to relax those overactive muscles. Okay. So it is non-painful. So it's not a stimulation, it's just like learning technique.
Learning about your body.
Learning about the body, exactly. Yes, how to retrain those muscles. So I give you example of decreasing the tightness or the overactivity. Same would apply for strengthening of pelvic floor muscles as well. Let's say the patient walks in with some urinary incontinence, and all women knows Kegel exercises. Okay, so Kegel is basically you strengthen those pelvic floor muscles, but what happens is 65% of the time they're doing the Kegel exercise the wrong way.
Oh no.
So yes, they use the accessory muscles, not just the pelvic floor muscles, but the surrounding, muscles in the neighbor area, and don't target the specific muscles. So that's when electrical stimulation can be used, or also biofeedback can be used. So the woman then know which particular muscle to target and how to target to strengthen that muscle.
Gotcha. Yeah, just, taking a peek at the model, obviously there's a lot of different tissues and muscles and things at play. So being able to have someone, articulate in a certain way that you can actually target those different muscles, I'm sure that just has to be helpful to have a visual, some feedback.
Sure,
Yeah.
sure. Because there are so many muscles as we see in this model. This is the pelvic floor. So different muscles here, but here are our hip muscles, on the side as well. So you can see how in a close proximity they are sitting there. So hip muscle wants to try help these weak muscles sometimes as well. So when, ask the patients, do your Kegel exercise, sometimes they are being told by their gynecologist or their, regular doctors, like, if you have leakage, do your Kegel exercise, just strengthen those muscles. But these muscles, they try to squeeze the buttock muscles instead of the pelvic floor muscles.
Mm-hmm. So you just got to make sure that we're in the right neighborhood there.
Sure.
So if I'm after, if I need pelvic floor therapy, is that something that I need a referral for, or how do I know when it's time to come see you?
Sure. So any patients, who wants to receive this kind of therapy, they need to have referral from either their, primary care provider, nurse practitioner, or their OBGYNs. Anyone can refer for, this kind of therapy. Mm-hmm. And there are some therapists available because not everybody can provide this physical therapy. Physical therapist who wants to provide this service, they need to have specialized training in order to evaluate and treat these dysfunctions.
Now, is this something that is typically covered by insurance, or how does that kind of work?
Yeah, so most of the insurance, they do cover the pelvic floor physical therapy. So as I mentioned earlier, this is a specialized form of physical therapy. So if insurance covers your physical therapy, then I would believe they won't have any issue covering for pelvic floor physical therapy, because it is a physical therapy, but just in a specialized form.
And so when should patients maybe talk to their providers about when it's time to receive this sort of treatment? Because I feel like it would be a little bit daunting if you're just like, oh, I'm not being able to hold my pee as efficiently as I used to, or...
Yes, so I would highly encourage patients to talk to their provider when they go for their annual visit, like routine checkup, because what happens most of the time is, like, we talk about the heart health or the lung health, but because of the lack of timing on the provider side and embarrassment on patient side, most of the time there is never discussion about the urinary leakage or the bowel leakage or the pelvic pain. And sometimes the like female patients specifically, they feel like, oh, I gave birth to children, or I'm getting old, so peeing in my pant is normal. But no, it's not. So when you go for your routine visit, just talk to your provider that, hey, I want to address this urinary dysfunction or bowel dysfunctions or pelvic pain that you are experiencing, and then your provider can refer you accordingly.
Mm-hmm. And so this being an area of physical therapy that maybe folks aren't as familiar with, but thinking about how if you're maybe going to physical therapy for, say, like your knee or something, you might have to go several times a week over a couple of weeks. Is that the same sort of time frame you might be looking for with this type of physical therapy?
Sure. So when the patient comes in for initial evaluation, it would be an hour-long session. And based on the assessment, the follow-up visits are determined. Most of the time, the frequency in pelvic floor physical therapy is not 2 or 3 times. It's not 2 or 3 times a week. It's usually once a week.
Okay.
Unless the patient is having pelvic pain or SI joint pain or some other form of pain, the patients would be seen frequently. But if it's just the urinary dysfunctions or like bowel dysfunctions, then it's usually once a week of session. And the patients are given appropriate, like enough exercise that they can work on their own at home, and then just have the follow-up visits with the therapist.
Mm-hmm. Yeah. So it sounds like you're kind of giving a little bit of homework. Maybe.
Yes.
And it's always important to be doing your homework.
Yes.
But what do you try and teach your patients what those exercises are supposed to look like properly before you send them off on their own?
Yes, of course I do, because I want to make sure, and as we discussed earlier, 90% of my patients, they come and complain, like, I have been doing Kegel for 10 years, 15 years, but I'm still leaking. So that's why it's very important to teach my patients the proper form of exercise or the proper way of doing exercise. So according to the assessment finding, I teach them when they come for the first time, and I give them enough homework. If they are pro in doing their homework, and when they come next time, then I can progress them based on their presentation at that time. So obviously it's very important to do exercise with therapist. So where they are doing mistake, or if they are not using the proper form, or if they are not using the proper muscles, that can be corrected if they are doing under the supervision of therapist.
Mm-hmm. Do you mind stepping back a little bit and going back through in maybe a little bit more detail just about the different conditions that you are able to treat with this? Because I find it fascinating that there's so many different facets of it.
Sure, yeah. So any patients, they are experiencing urinary dysfunction, such as like urinary urgency, frequency, urinary incontinence. Sometimes they're like, I cough and sneeze and leak the urine, or painful urination. They can talk to their provider in order to receive the treatment. Also digestive dysfunctions like bowel leakage or bowel urgency. They can also get benefit from pelvic floor physical therapy. Pelvic organ prolapse, where the uterus drops, or the bladder drops, or the rectum drops, all three of them drop. So it's called the pelvic organ prolapse. So in research, it has shown that pelvic floor physical therapy is very beneficial to certain grade. Also pelvic pain, SI joint pain, pain during intercourse, or any nerve-related pain in the pelvic region. All these conditions can be treated conservatively in pelvic floor physical therapy.
Gotcha. Are you able to potentially prevent any sort of surgeries by trying to take this route first?
So this is a physical therapy. Physical therapy is always prevention. Mm-hmm. So like the physician, they refer the patients, even like they're planning to do the joint replacement, let's say, they do like a prehab. So I would encourage patients, if you are planning or undergoing any kind of pelvic surgeries, you should learn the proper way of doing exercise for those pelvic floor muscles prior to surgery. And I highly encourage all postpartum patients to talk to their OBGYNs when they go for the follow-up visits at 6 weeks after giving birth, to receive this pelvic floor physical therapy as a preventive measure. Mm-hmm. So at least they'll learn how to do the exercise proper way, so they don't experience, if they're not experiencing urinary leakage now, they may experience in future. So, but if they will learn how to properly activate those muscles, then we can prevent, future incontinence issues.
Yeah. So what kind of outcomes or success rates do you kind of see with this?
I believe, pelvic floor physical therapy has relatively high success rate.
Yeah.
Again, it's a non-surgical first-line treatment options. It's a conservative treatment option. So any patients out there, if you are experiencing any urinary, bowel dysfunctions, or pelvic pain, I recommend that you don't feel embarrassed and just talk to your providers in order to start looking into the conservative treatment option.
Mm-hmm. And let's kind of dive into that a little bit more about, there's no reason to feel shame over this. Like, yes. If you need help, you've got to ask somebody.
Yes. And that's what I, highly encourage. And whoever patients that come see me, I just motivate them and give them a pat on their back, because they just take a step forward and talk to their provider and without feeling embarrassed about. I know everybody, we as a woman or man, we don't want to talk about peeing the pant, but it's very important to talk, and there is no reason to hide it. Just come and talk to your provider. Mm-hmm. About this, because there is a highly successful treatment option available out there, and it's a non-surgical.
Yes.
So yeah.
Keep you out of the operating room, which
correct.
Is that is I'm sure a weight lifted off of a lot of people's minds.
Yes.
So sorry if I missed it as we were talking about different treatments or I guess different conditions that this can benefit from. Overactive bladder.
Yes.
If I'm going constantly, is there any help that this can provide as well?
It does, yes. The overactive bladder. So some of the symptoms I mentioned earlier, urinary frequency, urgency, like going frequently, or have that urgency. So those comes under the umbrella term overactive bladder. So definitely, yes, pelvic floor physical therapy. Sometimes what happens is in the pelvic region, muscles, they are tight, overly working. So it kind of irritates the bladder, and bladder doesn't have that quiet environment, and bladder is angry, irritated, can give you that urgency frequency symptoms. So definitely, yes, this therapy would be beneficial in those patients.
Gotcha. If I'm somebody who's maybe gone to this type of physical therapy years ago. Is there ever an instance where I might end up needing to come back in the future?
Yeah, sure. So when I was in Florida, some of my patients, they were coming like once every year or 2 years. So they just come, learn, because what happens when we leave the physical therapy department doors, we just forget to do the exercise. So they were like, they're good in doing their homework for a month or two after discharge, but they kind of feel like off track after that. So patients, I would encourage, like, you don't need to come like 10 or 12 sessions, but just like, after, like, just fine tune up maybe. Something like that. So definitely they can get benefit, just doing few sessions of physical therapy after many years of discontinuing if you are experiencing any new symptoms.
Got to keep up on that homework.
Yes, very important.
So I've asked you a lot about this topic, but not given you the full floor. Is there anything that I've not asked about that's really interesting about your field that you'd like to share that you think people should know?
First thing I wanna, thank you everyone for listening this, and I wanna encourage all patients not to feel embarrassed if you are experiencing any urinary bowel dysfunctions or pain during intercourse. Just talk to your provider, because in my experience, I have seen very good success or outcome with these conservative treatment options. I kind of encountered or listed all the conditions that is being treated in pelvic floor physical therapy. So again, I'm highlighting any urinary leakage, urgency frequency, pain during urination, or fecal urgency, or bowel leakage, or any pain during intercourse. Or post-operative pain, like sometimes the patients, they come like, oh, I have pelvic reconstruction done, like that's a surgery for organ prolapse. But like maybe, like there is no 100% guarantee that you would get 100% by undergoing surgery. So maybe 4 or 5 years after any form of pelvic surgery, abdominal surgery, you may start having symptoms. So I would highly encourage that it's a time to look into these first-line treatment options, which is conservative, yeah.
And we do still have a couple of minutes. Are there any cases that maybe come to mind that were maybe particularly challenging, but the success on the other side, really made it worth it for that patient to go through this?
Sure. So that particular patient comes to my mind all the time. When I was in Florida doing my women's health residency, she was a 67-year-old retired principal, school principal, and she was suffering from fecal incontinence issue, and she was so embarrassed that she started restricting her social life. So she couldn't talk to her regular doctor when she used to go for routine visit, because all the time, as we discussed earlier, the regular doctor, they want to highlight heart health, lung health, but they didn't have time to talk about the digestive or urinary system health, because then the patient was feeling embarrassed too to talk about that. So she accepted that issue as a part of getting older, or giving a birth to a 9.5 LB child.
Whoa.
Yeah, so she kind of tore her pelvic floor quite a bit when she delivered many years ago though. So pelvic floor suffered quite a bit of trauma in sense. And for 5 years, she suffered in silence. One, her gynecologist visit, she just fell down. So gynecologist took her time, and because she felt distressed, so just her gynecologist asked her if there is anything that was bothering her. That was the first time in 5 years she spoke to someone that she is leaking her bowel.
Oh, bless her heart.
Yes, so her gynecologist, obviously she was highly supportive of pelvic floor physical therapy, so she immediately referred, and that patient came to the clinic where my posting was. So I saw her first time. Obviously the first session was just like getting to know the patients and develop that relationship with my patient, because this is very, sensitive topic. And nobody, or most of the time patients don't feel comfortable talking about it openly or too much during the first visit. But I just want to shorten this topic that the patient, I saw that patient for 10 visits, 2.5 months. It was once a week session. And the patient was not using any pad, or just, started living her life the best when I discharged her. Oh. So that was really, rewarding moment for me, and obviously my patient as well.
Right, she got her freedom and her independence back. I mean, that's nearly priceless, honestly.
Yes. So that was a very, successful outcome that I received, and my patient was all over the cloud.
Well, as we are wrapping up our conversation here, is there anything else that you would like to share with our viewers that you think might be valuable for them?
Again, if you are experiencing any of the symptoms that we discussed earlier, don't feel embarrassed, please. I understand this is a sensitive topic, but there is a high success rate if you wanna, just look into this pelvic floor physical therapy. So please talk to your providers when you go for annual visit, or even if you don't have any annual visit, if you are experiencing the symptoms that are quite bothersome to you, then please, I would encourage you and talk to your providers so they can start referring out and you can start living your life to the best.
Very well put. And of course, once you get connected to someone like Dr. Vora, be sure to do your homework. Don't let that slide for sure. No. All right. Well, Dr. Hetal Vora, thank you so much for coming on Being Well today. You've been a wealth of knowledge. I appreciate it.
Thank you so much. And again, thank you everyone for listening to me.
Yes. Thank you to our viewers for watching this episode of Being Well, and we hope to see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.